Okay, hello there. Good morning, good afternoon, good evening, whatever time it is, wherever you are that you're watching us. This is Living Health TV Live, and my name is Gbenga Adebayo. Today, we are doing an Ask Me Anything, an AMA. So, it's an open house, open session. You can ask whatever burning questions it is that you have disturbing you, wanting to know better, of concern to you and your loved ones. As we usually do, I'd like to ask you to please invite your friend. Like this video if you have not done so. If you have not subscribed to our channel, please, by all means, go right ahead and subscribe to our channel. I'll just do what I just asked you to do right now and let people know that we are live. And it is, of course, an Ask Me Anything. Let's go right ahead and let everyone know that we are live, right? Okay, this is the link right there. Uh, okay, yes. AMA, Living LTV. Okay, drop the link right there and post it. Right? Let's see if we can also put it quickly. Uh, uh, so be getting your questions ready. Good afternoon, Michael. Thank you. And we are live, right? A, A, M, A, out, out, TV, on YouTube. Okay, let's drop the link there. Okay, so whatever questions you have, we have some bank of questions that people have, and my assistant will be helping us to post it in the chat. But you can go right ahead and drop all your questions in the chat box. If you've not liked the video, please remember to do so, to like the video, and we go right ahead. So can we have our very first question? What is the very first question that we have? Let's have it. Right. Our first question. Okay, do we have our questions? Can we have our questions? Okay, how do I know if I need more iron? Okay, beautiful question. And this is will be very important, of course, for the females. This is going to be more important for females. But of course, we know that iron deficiency anemia is a problem for male and female alike, especially in the developing world, but more so for women for obvious reasons. A woman menstruates usually every month if they are not pregnant. And when you lose blood every month, you are losing iron. So it's quite important that you replenish that iron, more so in pregnancy. So iron is one of the stable supplements that you give to women while they are expecting their children. So it's important that iron deficiency anemia be prevented, um, and be taken care of, be cured essentially. So, how do you know if you need more iron? If you are anemic, right, the odds are that what is causing your anemia is iron deficiency anemia, because that's the more common. But there are other reasons why somebody may be anemic, and the person does not need iron, right? So that you are anemic, that your blood level is low, does not necessarily mean that you need iron. So, for instance, someone that is a sickle cell disease patient does not need more iron. So you can get iron overload. So whatever it is, how do you know that you need more iron? Please let your physician diagnosis. And if you have been told to take iron supplements, please go ahead and take them, especially if you are pregnant. Pregnant women need to have their folic acid and iron supplements, and they need to take it. Very, 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 very important. Okay, Olumide asked a question there and say, what causes low sperm count for men? What causes? Thank you. Good afternoon. So, what causes low sperm? So, there are many reasons why a man may not be producing enough sperm, right? It could be an hormonal reason, because sperm cells are produced as a function of hormones. But commonly in our environment is as a sequel to infection, long-standing untreated infections will give rise to low sperm count, and that's very common. A lot of people think it's, in fact, I've heard someone tell to me many years ago that it's a thing of pride to have gonorrhea. It just means you are a man, right? It means you have arrived. You are now fully mature. That's not true. And gonorrhea not properly treated, long-term gonorrhea will lead to low sperm count, will lead to urethral stricture, and that's really serious. That's a serious thing in the long term. So untreated infections will lead to low sperm count. And then, of course, there are anatomical defects, right? Where a man, something is wrong with the tract that carries sperm from where it is produced to when it is needed. If that anatomical defect, right, is not taken care of, that man may have a low sperm count. So what do we do to correct that? Just a simple surgical procedure to connect what should be to where it should be, and to remove that anatomical defect will lead to an improved production of sperm cells. So what causes low sperm count? You need to see your doctor from the various reasons, from the very many things that can cause it. Is it an infection? Of course, we treat the infection. If it's an anatomical defect like I've just described to you, it will be quickly corrected. But what is important to say is that no matter, once you are producing sperm, you can have your baby, right? Even if it's one that you produce, one every month, one part, one is very low chances. But the point is, if you are having sperm cells being produced with the right assisted reproductive health techniques, you can have your child. You and your partner can have your children. So go see your physician. Don't keep quiet in silence. Don't live in shame. Go find out what is wrong and get it sorted out. Right? I get the goal of it all is ultimately to have a child. And with the technologies available today, mm, you can have your child, right? You can have your child. And in Nigeria, you don't need to travel. Wherever you are in the world that you are in, the technologies are available, right? Julian is asking, good afternoon, Julian. What about if you are not pregnant? Can you take vitamin D just to be able to? Yes, certainly. You can take, but we need to know that vitamin D in the environment is common. Sunlight is good, and not dairy products will give you the precursors, fish products. But there is something like, we know vitamin C deficiency is very rampant, right? So we're even talking about in the public health circuit, there are discussions about fortifying foods with vitamin D and vitamins that people are deficient in. So it's not just pregnant women that need vitamin D. We know that vitamin D deficiency is a cause of so many. No, it's a factor. Not, let me not say it's a cause. It's a factor in a number of conditions that we're worried about. So we encourage everybody, and in an environment, the sunlight is there. So please go out there in the sun. Let your kids play out in the sun. Let them run around. Let them do so safely, because you know. Let them do so safely, but let them have more sunlight and let them eat a lot of those dairy products that are have good precursors to vitamin D. And if you still need supplementation, please feel free within reasonable limits. Don't go on long-term supplementation without your doctors say so, right? Please discuss with your physician. Fantastic. Good question. Beautiful questions coming in. All right. Can we have our next questions from the bank? Let's have our next question. If more questions, you can just be dropping your questions. Uh, this thing. Okay, Julian is saying how much vitamin D is too much. I would not be able to give you the figure of my head right now. But of course, there's a reference range for what vitamin, but we don't regularly often, unless we start to suspect that person has vitamin D overdose, you don't reference. But of course, there is a daily recommended dietary intake. I'll ask my colleague to just look out for that and see if she can find it and drop it in the chat box. But um, what I'm against is some people take so many supplements from different sources. So they take this one, they take that one, they keep popping pills. And vitamin A, D, E, and K are fat soluble vitamins, and they linger long in the body. So if you get to the state that you treat, we know that for a lot of people we have a problem with deficiency. So if you now get an overcome your deficiency, there's something that can happen if you take something so much, even something like vitamin C, that's really great, great vitamin. You can take it so much and just abuse it that you start to have a build up in your system and you can have problems, right? But I can't, off the top of my head right now, I don't know the recommended daily dose, right? Yeah. How can I control mood swings? Very beautiful question. And mood swings are for male, female, right? Of course, someone may say that, okay, it's more common because of the hormonal impact that happen, cyclical hormonal issues that happen to men. Okay, so my colleague has brought it out, thankfully, with the right information. Please, can we have the source for this information? Where did you get this from? Let's source it. There are a lot of let's source it. So you can just put the source along with that information. So so what we have is 400 international units for children up to the age of 12 months, 600 for people from 1 to 70 years, and 800 international units for people over 70 years of age. So dietary, so that's the daily recommended. And then you can go check it and confirm the source. I would like us to get from variable source like WHO, um, um, uh, something reputable, right? Okay. So talking about the mood swings, like I was saying, so male, female have mood swings. Now it's important for you to now recognize what's at the bottom of your mood swings. We know that, of course, hormonal changes monthly can be behind some people's mood changes. And so we need to find out if your mood swings are cyclical, are they tied to a particular season of the month? So if it's that, then we can say, okay, so it's due to hormonal changes. And you can have mood disturbances that are tied to a pathology. So it's not tied to a time of the month. It's just tied to a pathology. And there are anxiety disorders. There are all kinds of disorders that can make someone to be person's mood to be very labile. So you're happy right now, and then in the next few moments you are, you are off and angry. People find it difficult to live with you. People find it difficult to discuss with you because they can't predict how you react. So there are disorders that we start to suspect if that is the case. And with even normal, nothing needs to be pathologically wrong for your mood to change. If somebody annoys you obviously will get angry. If your financial situation is not It's not where you'd like it to be. Your mood can be on the you can feel down, and that's understandable. So it's for us to know what's causing your mood swings, and for you also to be attuned to your mood. What I say to people is that our feelings, our emotions, we get to a state that we know that they are not predictable, that they are not totally trustworthy, right? They are not totally trustworthy, right? So I would like us to please try to get these directory changes from the WHO website. Just look for it. Medicalnewstoday.com, maybe a good site. I don't know, but they will reference somebody. So let's try to get a reference from a reputable um, global organization, um, and then we can. So it can be the Nutritional Society, Um, so we know that there's science. So medical news today will probably just reporting what somebody else has said. So let's find out who medical news today is citing for us to know what is the recommended. And that's the way we do research. This is how we know, because that something is online doesn't make it true, right? Someone says it's online, I find it online. And that's why we're even doing what we do, because there are a lot of stuff online that are totally rubbish, right? You see it shared on WhatsApp page, shared on Facebook, shared everywhere, one website. In fact, you see some videos. I've seen some videos that the production value is so high, right? That somebody put a lot of effort into producing those videos, and those videos, they are full of, pardon my French, they are just full of, they are full of it. They're full of bad stuff, not total rubbish. But so that something is online or something looks sleek and well produced and fantastic does not mean it is backed up by evidence, does not mean that it is true, right? So control your moods. We need to find out what's up with your moods. Is it a pathological thing, or it's not pathological? Probably just normal, run-of-the-mill emotional response to the issues that are happening to us, or something happening to you physiologically. Just your regular. It's for you to be in tune with yourself. There is the practice of mindfulness, for you to know this is how I feel right now. Try to find out, this thing that I'm feeling, is it justified? Do I really need to feel this way? And then correcting. So we do what we need to do, not based on how we feel. At least that's how I try to live my life. If I did, if it's going by how I feel, I probably will not be online at this time, because I think I do need a rest. I need to take a long break, and just relax, right? But I promised you that I'll be here today, and here I am today. Okay, so we don't do things because of how we feel. How we feel often is dependent on various factors, and those factors may not actually be factual, right? So we do things based on how we need to do it. And guess what? Starting this, I was feeling down, but after I started talking, doing the things I need to do, my mood has actually improved. I feel a burst of energy. That's why I say to people, your emotions, they can be controlled. They can be controlled. So don't let your emotions rule you. We rule our emotions. Right? Great. Next question, please. Next question. And if you have a question, please, if you have follow up to all I'm saying, please drop it in the chat box. We'll be happy to discuss and together. Right? Okay. Next question, my colleague. I hope I'm making sense. Okay, what is the cause of thick blood in the feces? Wow, that's a super question. We don't even want faint blood in the feces. Not to talk about not to talk of thick blood. We don't even want invisible blood, because there's a condition where you can have it's not visible to the eye. We call it occult bleeding. We don't even want that, right? We don't want occult bleeding in the feces, in the stool. Not to talk of thick blood. That's thick, frank blood. So what we'll be asking is the blood on the feces, or is it mixed with the feces? Because those represent different things. You will have blood in the feces if something is wrong in the GI. There's an injury in the gastrointestinal tract, that is from the throat. That would show something different to the stomach, show something different to the intestines, we show something different. The small intestines, the large intestines, or the lower part of the intestines close to the external exit, or even just around the anus where the blood is going to come from. So anything that goes wrong there, any injury along that line will lead to blood in the feces, and we don't want that at all. So anytime you see blood in the feces, don't take it lightly. Please don't be embarrassed, right? I know it's an embarrassing thing. People don't like to talk about feces. They don't like to talk about those body fluids, body motions, all the things that happen. Anything that has to do with the private part, the perineum, and the pelvic area, right? We don't want to talk about it, but please don't be embarrassed. That's why a lot of people would rather just do things by themselves than to treat hemorrhoids. Hemorrhoids is one of the things that can cause blood on stools. That's when you have a growth, a swelling, a protrusion, right? A bulging out of your anus. Some people learn to pull it back. Some people just then it can be painful, all kinds of stuff. But please don't be ashamed. Don't wait until it's now an emergency that you need to be rushed upon to operate, to know the cost, the fear, right? Don't wait till that time. So you see blood on your feces at any time, please go see your physician. And it could just be an infection. There are some infections that will cause blood in stool. So we want to treat that. Even diarrhea, brain training. You don't even you are just training, constipation, right? Can cause all that, right? So please, whatever it is, go see your doctor. Let's find out what exactly it is that's causing either faint blood, not even talk about thick blood. We don't want thick blood. Please, let's go see our physician, right? Thank you. Thank you. Next question, please. Why does my asthma get worse at night? Why does my asthma get worse at night? Okay, so asthma is a disease of the airway. The airways is an inflammatory condition. What does that mean? It means that you respond to people that have asthma tend to respond very vigorously to things that other people may not respond to. So their airways start to fight dust, start to fight any little stimuli. And this part of this stimuli that they will fight is cold, right? Right. So when there is cold air, a cold draft, the airway will now shrink. With the shrinking, they also now produce mucus, more mucus than usual, and then of course the person um, gets an acute attack of asthma. So it's because of the cold air, um, and maybe you are also exposed to, I don't know what is the environment, what's in your environment. Maybe if you are also more exposed to dust at night, in addition to the cold, then there can be an exacerbation of the asthma. So the important thing is to stay on your meds, right? Your preventive meds and your regime that your doctor has placed you on, if you're on any, and to prevent and to stay warm, stay well covered, stay in an environment free of dust, free of cold draft. And if it's getting worse, please, 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 please. If I can say the please 50 times, I'll say the please 50 times. Don't don't take it lightly. Go to the clinic. Go see your doctor. You're always saying go see your doctor. Yes, please. Go see your doctor, especially for a condition of asthma, because asthma can kill, right? An acute asthmatic attack, not well taken care of, getting worse progressive, and just say, I'm just fine. I just take my inhaler, just breathe in. Now it's not getting better. You're getting worse. You're just managing yourself. No, don't do that. Please run to the hospital, see your physician. Let's get you looked at and treated. Right? Thank you. Thank you. Next question. Next question. Please, if you are following online and you have your questions, go right ahead and drop them in the chat box. will be happy. Wow, this is an interesting question. The hair around my pubic area don't grow. What could be the cause? I don't know. Maybe you're not airy, right? So maybe you're not airy. I would need to ask your age, how old you are, and maybe you're not just airy. Different people are not airy on different parts of their body. So maybe you cut it some time ago, and you're not airy. You don't grow. So no matter what happens, I don't grow. I don't have beards. This is all as much as it will be. But is anything wrong? No, no, that's just me. That's not my. That's just my genes, and I have an afro on my head. So it's just different people, um, different things, right? So if nothing else is wrong with you, you have no other complaints, and your partner is not complaining. I don't even think your partner should complain about that. In any case, if you're married, whatever. So you uh, you just leave it. It doesn't disturb you. Okay, is it hygienic to leave growing or to cut it? So I assume you're talking about your pubic hair. There's nothing wrong with leaving it. And there's really nothing also wrong with trimming it, being careful not to harm yourself. It just depends on you, what you like, what the significant person in your life also thinks about it. uh, Whatever tickles your fancy, please go ahead at it while staying safe. Right? Some people do Brazilian bikini wax because they wear bikini, so they want to look okay. All those things are determined by society, and then it's where they just strip their hair, and it's really painful. And I'm looking out. You do this just to be able to wear a bikini. Thumbs up to you. But so whatever is cool for you, please go and right ahead and do it. What you find taking your fast, but there's nothing wrong if you say your pubic hair is not growing. I don't know how whether you want to be able to use a comb there, but there's really not a problem um, with it, right? Is it can a wheezing sound from a please? I don't want you to do hot air installation at home, right? So I just said to you now that asthma is a disease of the airway. So the airway is not responding or over responding to stimuli, right? Unless your physician prescribes steam inhalation to you, and you must do it. He or she will describe to you how you should do it safely. There are some conditions why we say, okay, we want steam inhalation, but certainly not asthma. You do steam inhalation in an asthmatic case where there's wheezing, because that's where we have wheezing. That's where we get worried about wheezing a lot. You have stimulation in a someone that has asthma. It's like you are pouring petrol on fire, right? We don't want you to do that. Not at all. Not at all. So please go see your physician and let's know what's happening. Let a diagnosis be made as to what is causing the wheezing, and then we can see whether stimulation during the days of what was that disease that people were COVID, right? COVID. During the days of COVID, some people were doing stimulation. People actually harmed themselves because they were inhaling steam, because somebody said the virus cannot grow in oil. So they arm themselves. Some people put themselves in terrible danger doing this help remedy. So please be careful, right? Let's be careful. Great. Are there lifestyle changes that can be made to cure asthma? Someone said that there are from foods that you can eat to cure asthma. No, please. No, please. All right. So asthma, if there were, I wish there were, right? I wish there were food. Of course, there are lifestyle changes we want people with asthma and even other chronic conditions to have. We want you to avoid dust, right? We want you to avoid stressful conditions. We want you to avoid cold, heat. Those things are lifestyle changes. They are things that you need to know. Take care of yourself. Stay careful so that you don't have things that irritate your airway. But there's no food that I know of, and if I don't know of it, um, it's probably not. It's not so. There's no food. Let me just say that point blank. There's nothing you eat that will take asthma and cure it. No herb, right? So what we just want, of course, some people leave after a while, after the early ages of struggling with cancer. They learn to know the things that propel them. And that's why we say lifestyle changes, adhering to their medications when they need to have their medications, when the doctor says to them, and they live with it, and it looks as if it has gone away. And fantastic. So they've learned to take care of themselves, but there's no food per se that you say you will be eating this. If you eat this, then your asthma will be cured. Not nothing like that, right? Fantastic. Thank you, BG, for that beautiful question. Any other question? Let's go on. We can take 2 or 3 more questions, and then at least if there are no, this 3:30, we can take a few more questions, and then we can wrap up for today. I hope we are being blessed. Let's remember to share this with friends. Okay, does abortion pill work for everyone? We should not take them. Okay, so um, abortion pills, what people call abortion pills, are hormonal drugs, um, and there are different things that they work at different times. What I'd like to say is that very important is control. Birth control is important. If we can have more birth control and proper knowledge, then we would. So for instance, let's first talk about the people that are in a relationship with someone and they are willing to have a sexual intercourse. So you need birth control. If you use condoms, if you use the various methods of family planning method out there, then you will be able to prevent an unwanted pregnancy. And unwanted pregnancies cause a lot of disruption in life, to life and well-being, both to the female, especially to the female, and to some degree also the male. Now, it's also important to have proper knowledge to know what to do. For instance, in the instance of sexual abuse, sexual violence and rape, it's important that you know what to do within the first 72 hours after that encounter. Don't hide. Don't there are pills, morning after pills, yeah, emergency contraception, we call them, that you can go take that will help prevent pregnancy, right? So, but you need to do it quickly within 72 hours. Anybody that's been a victim of rape, sexual abuse, needs to know what to do. Don't keep quiet. Run to that healthcare facility. Go to that health provider and get the counsel that you need, get the protection that you need, and prevent an unwanted pregnancy. And beyond unwanted pregnancies, you need also to be treated for exposure to diseases, right? And you need to do it pronto. You need to do it very quickly. So we see people victims of rape, and then person is ashamed. Rape is never the fault of the victim. Never the fault of the victim. So if you're a victim of rape, of sexual violence, sexual abuse, please go for help. So to answer the question, does abortion pill work for everyone? If pills are used the way they are meant to use, I reckon they will work in the doses. But of course, there's no medicine, there's no treatment regime. There's no side effect, right? So I think the point that is critical here is let's have all the information that we need. Sexual violent victims need to go for help. They need to go for help pronto within the first few hours. Don't, as soon as you can get to go for help, please go get help. Don't be afraid. Don't be ashamed. It's not your fault, right? And you can get care with confidentiality, with respect for your privacy, and then by the grace of God, with right, the victim, the perpetrators be brought to justice, right? Even just let's do the right thing. We often in the environment we bring God into everything. I'm saying go for help, and you will get the help that you need, right? Thank you. Next question, please. Next question. Let's take 2 more from our pool that people have put up, and then if people also, does ovarian cancer stop menstruation? Ovarian cancer, you know. So I reckon maybe this person here is worried about why my menses are stopped, because if you have ovarian cancer, menstruation is going to be the least of your worries, right? Ovarian cancer is a deadly disease. So There are many reasons why somebody menses may stop, and it's important for you to pay attention to them. If your menses just suddenly stop being regular, let's find out. Let's know what is happening, what is causing it. Certainly, cancer can cause all kinds of crazy stuff. But beyond cancer, cancer is not the only thing that can cause menstrual disorder. So menstrual disorders, oh gamut. Let's not be afraid to find out what's happening and nip it in the bud. Right? Final question, and then we wrap up for today. Final question. Unless our people have questions, anybody online is free to ask any question. I will answer all questions of people that are online. Right? Final question from the ones that we have in already. Okay. Is it normal to feel pain in the breast and hand before or during your period? Okay. It seems we have a lot of women out there asking questions. Okay, so the with the cyclical hormonal changes every month, there are breast changes. So that's one of the reasons why we advise people to choose a day in their cycle where they can do self breast examination. Right? Just choose a day in your cycle. Okay, it can be the third because depending on the time of the month that you check the breast, it feels different. I mean, sometimes it may feel doughy a little bit. Sometimes it may be a little tender. So just choose a day in your cycle. So it is possible to feel some tenderness, some fullness, not pain. Not it shouldn't be so overtly painful. If you're having extreme pain in your breast, we need to go and get it checked out. Get to go and find out what is, because we shouldn't. Pain is not normal, right? If it's paining you, then we need to find out why is it paining you. But you can still some mouth tenderness, some fullness, depending on the time in your cycle in a month. And if you've noticed that, you would have noticed that over time. So that is a possibility. But no, angry. Please go ahead and ask Julian. Let's have your question. And Julian's question, unless another person online has a question, will be the final question for today. Right? So please go ahead, Julian, ask your question. I'm waiting. I guess she's typing. Okay, so everybody needs to, every woman needs to know a cycle. Um, okay, that's strange, man. Okay, she said, Julian says, I just saw a post on Instagram where the ladies were talking about tasting their period. Is this right or healthy? So I need to understand, what are they trying to taste there? What are they looking for to taste in their period? So maybe if I understand, because that's strange and news to me. I want to know what you will be able to diagnose by tasting something, because what happens in your period is why does a woman have, why do we the woman have menstrual? What's this curiosity? So is the womb, every month the womb prepares to nurture a baby, prepares to nurture um, a fetus, a baby to be implanted, and based on two hormones, the hormones that the body release. Um, when there's no baby, the body stops the hormone that makes the internal lining to grow and releases another hormone, and then that lining that was preparing to harbor a baby is shed, and that's what you find as as your menstrual cycle. So there's no known to me. There's no reason known to me or that we know so far what tasting it's just like tasting your feces or tasting. Uh, uh, so of course it's a body fluid. It may taste, but there's no reason why. There's no benefit, so to speak, that you can accrue, that you can think of right now, that will come from tasting your menstrual cycle. I know that will be repulsive to many people, but people do a lot of funny stuff. So I'm not sure it will harm them. I don't think it will harm them unless they have an infection or they have something and then introduce something, an infection from their genital tract, and introduce it to their oral, but there's no benefit to it. So I'd say, please, curiosity can kill the cat. Okay, Olufemi has a question. It is widely known that we can't get all the nutrients as we grow old. Please recommend the supplements to use as we grow old, just to slow down the aging process. I'd say that it's not we for in old age, especially for the women folk, we may recommend that they get some calcium into their system. But it is possible to get as much of the nutrient that you need from a wholesome diet, right? From a wholesome diet. You can. The supplement industry is so big, it's so fun, massive. But a lot of the things that we have in the supplement industry that we found out is that actually a lot of those supplements may not be helpful. They may actually be unhelpful. But there's the other side of the divide that says that there are some things, there are some chemicals that if we start to take them, that they may be helpful, but that's still the science behind that is still not totally clear. So I'd say that to everybody, a carte blanche idea of saying just go on this supplement for old men, for young women, for all this may not be helpful. At this time, there's no evidence to suggest that, to support that. What may be helpful, of course, is wholesome nutrition, right? Eating healthy, adding greens, vegetables, natural food, reducing, and then a lifestyle of exercise, which is difficult for some of us to do, right? Drinking healthy, a lot of fluids, a lot of water. Those things may actually be more important. Lifestyle of relationship, playing, they are actually more important than that you can get health and life longevity in a pill. I know it's very appealing to think that once I buy this, then I will live longer and live healthier. It's very appealing to think that we can do that. But the evidence so far suggests that the multivitamin industry, the supplement industry, is actually somewhat more harmful than just eating healthy, staying well, and making sure that you take as you. Uh, oh yes, women are their wahala tasting period. Oh, all right, so different things. But I think today we'll be really taking care of a lot of feminine questions. Maybe next time at our AMA, we hope the men folk will come with their own questions as well, and we'll be able to answer them. It's been a fantastic time with us today. Thank you all for taking time to join us, our regulars, Julian, Temitope Adeyanju, OBG. Thank you, Madam Odope. Thank you. Olasimeji Olumide, thank you. Olumide, thank you. Thank you. Everyone that has taken time. Michael, thank you so much for taking time. We've answered so I think we should share this video in that group where they are tasting period, so that some people don't say, maybe it's good though. I can know whether it's salty this month or whether it's sugary or peppery. Whether it's peppery some other month and whatever that means, there's no benefit to all that, and you may actually harm yourself. Like I said, there are things that are meant to stay where they are. You should not be introducing and crossing. You should not, especially if there's an infective process going on. The menstrual cycle should be clean. You shouldn't have the female genital tract. Actually, it's not a dirty place. Like I tend to say to people all the time, we tend to think it's a dirty environment. No, 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 no. The womb is pretty sterile environment. So is the upper female, the vagina itself. It's also not a dirty place. It's the vulva, the area outside that has some natural germs that are there. They are not bad germs. They are not dirty germs. You don't need to douche and do all those funny things. that does. You don't need to do that, right? It's not necessary. You don't need to. Just normal soap and water to cleanse and wash and stay clean, and we are the best boys. So we don't need to be tasting what's not what's not there. So if you have an infection, you have a bad infection, and you're tasting it, and then you introduce it to your oral tract, so the person can have chlamydia of the mouth, can have gonorrhea of the mouth, can have all kinds of stuff. We don't want that. Huh? We don't want that. Right? Thank you so much, everybody. Beautiful day. Have a fantastic weekend. Please share this with friends. If you have not liked the video already, please go right ahead and click that thumbs up button and let everyone know that you've enjoyed the program today. See you again next week, Friday. Merry Christmas. Biliam Ipopola. So I think that's an interesting question. I'm going to also discuss it with my friends and my significant one when we meet later in the day. So thank you so much. God bless you. Have a beautiful weekend ahead. Remember, as area doctor they say, life here, you don't get duplicate. God bless you.